Maharashtra government had awarded tender in 2013. That tender period was for 3 years till 2016. And we attempted tender 3 times from 16 to 19. But these 4 public sector government companies, they have distributed these 4 zones among themselves, and they literally do cartelling. Like one company is L1 and others will give supporting bids. In Maharashtra, for 2 tenders, for similar packages and similar number of procedures and similar rates of packages, the rates were 1600 and 1800 and 1900 for 3 tenders, or earlier 3 tenders, by the same public companies. And when we made it open to like private and public, and when we divided state into 2 halves and all that, then our rate, the same companies gave us 797. So like,
I'm not saying public companies. Anybody could participate.
So means 3 states should come together and do a tender.
That's what I am saying. West zone, east zone.
But I don't know like how we can put money from one public exchequer state and pull the money. I don't know. Like like accounting procedures will not allow such things.
The rates are freezed by NHA and sent it to us, and we implement that. That's what I'm saying. I'm not saying the states should tender. NHA tenders it for the entire country. Okay. Okay, anyway.
The states are not implementing the scheme in a similar construct. Every state has different packages. Like, let's say Maharashtra has their own package, 1.5 to 2.5 lakhs. They have not converged in terms of 5 lakhs. So the insurance company would only come across and come forward in case all the states, participating states in a particular zone, are implementing the same state with a similar type of package, type of construct of the scheme. And secondly, only 8 states are implementing on insurance mode now. So most of the states are not even comfortable with insurance model. So the insurance companies will also not be getting a base in case we come forward. If the concerned state should do the tendering, the current practice appears better.
Okay, thank you.
Sir, regarding implants like e-rupee concepts for the lab diagnostics we are going, can we go that companies who are procured at the lowest rate, they would provide it available to across all India public hospitals, and the payment would be directly going to them after the utilization? Because problem is company get the rate contract but they don't make available. That's the major issues in every remote corners. Strategic purchasing, that's why. Because NHA, if you do major like cardiac stents and these, they tell like the payment could be directly linked to the utilizations.
Frankly speaking, sir, in Maharashtra, to be very blunt, there is a lot of opacity in procurement.
That's for every medical college.
Hospital level. So we are looking into it, and we are making state level procurement. We have medical procurement division, and we are pulling the demand.
So actually, what you are saying is absolutely correct. So what Dr. Shankar Prinja and his team is currently working on is defining and designing the modalities of strategic purchasing and how we can collate the demand and come out with, and there should be clearly defined quality standards for procurement, at the same time collating the demand and finalizing the rates, and our partners can procure if they want. So we want to create that framework, and a new HEFTA division is being set up in the HHQA, which is working, and Dr. Shankar Pinja's team is working on that. And as you mentioned, we need to work on the quality of the things which are going in, including the stents, the implants, as well as the prosthesis, all these things.
Sir, one thing, like drug registries we are creating now. For medical device, we should create.
It is being created. Medical devices, actually, Praveen is working on that thing. So that is a separate thing which is going on as part of Abdm. But procurement, as you said, procurement, we are trying to study the systems of GEM. We are trying to study the systems of HLL's procurement as well as the Jan Aushadhi, and we want to create a platform where demand and supply, like the buyers and the sellers can come together, and the NHA can facilitate that process with fixing the quality standards also. Thank you very much, Dr. Das.
Good afternoon all. I'll walk you through the progress with ABDM in the UT of DNH and DD. think this is the wrong presentation, ma'am. It's from Goa. Yeah, next slide, please. Yes, so this is where we are going, or the current status of ABDM in the UT. We have a state mission director and I am the state nodal officer for the mission. And our UT has state specific HMIH, which is e-Arogya. A brief history about e-Arogya is that it has been implemented since 2014. And the district hospital in Silvassa, the Vinoba Bhave Civil Hospital, it was the first district hospital in the nation to go paperless. I think that credit goes to our director, Sir Dr. Das, who was just here to present. So we already had the infrastructure in place, staff was trained with the HMIS, and all the facilities were paperless already. Currently, the number of facilities with HMIS is 132. All the public health facilities are integrated with HMIS up to health and wellness center level. Total ABHA created stands at 5.23 lakhs against the target of 5.89 lakhs that we receive from NHA, which is about 90%. All the government facilities and government doctors have been registered under the HFR and HPR. Private facilities and doctors, we are facing few issues, few resistance. We have achieved about 70% registrations in the private sector. Next slide, please. So this is a snapshot of the ABHA IDs created till date, and we are very positive that by the end of third quarter, we'll be generating 100% of the target IDs for the UT. And as far as linkage is concerned, currently 28,000 health records are linked. It's a slow process because we are only being able to link the records once that particular patient with the ABHA number, with the HMIS ID, visits the hospital for any of the treatment or any of the facilities. Next slide. So health facility registration, 100% in the government sector. Private hospitals, clinics and laboratories, we have reached 70%. But we are ensuring a drive in this quarter, which will ensure that all the 100% facilities are registered under HPR. Next. Same status for the private doctors also. Roughly about 70% are registered. Those who are not registered are basically refusals. We have had multiple sessions of awareness, multiple sessions under the medical associations with the senior authorities, but still they have their doubts, their concerns regarding the mission. We are in process of developing a program management unit as soon as we receive the funds. The proposal at UT level is already ready and approved by our secretary. Next. So as far as HMIS is concerned, it has already integrated. Every public health facility is under HMIS, and it's a comprehensive HMIS. So it is a completely paperless system that we have right from the district hospital to the health and wellness center. Capacity building, training for HMIS happened with the happened before the advent of ABDM. But since the advent of ABDM, now we have also completed the integration part. We have completed all the 3 milestones. We are just left with the security audit before successful certification. So simultaneous training for all the staff was done by our existing IT teams. Kind of hand-holding wherever we faced issues. All the staff was trained on how to generate the IDs whenever a patient comes to the hospital. So any OPD registration, we already have linked the ABDM systems to our HMIS system. So ABA IDs are automatically generated and all the concerned staff is already trained. IEC, we've already done it. We are also scaling it up a bit. So we are pushing it through social media now. We have created few videos about ABDM, how it works, how it will be useful for citizens, and how it will transform the healthcare system. Next slide. Linkages, we have already, because our PMJ is also on the same platform as ABDM and as HMIs. So PMJ and ABDM will be easily linked in the next financial year or when the policy renewal ensures. And apart from that, we are also looking into integrating the ABA with all the social welfare schemes or any welfare scheme that is being run by UT. Next slide. I think that's all. Thank you so much.
Thank you very much, Dr. Meghal Shah. That was a very interesting presentation. Thank you. So, ladies and gentlemen, let's call on stage Ms. Dikshita Borkar and followed by Mr. Pawan Kumar, Operations Manager, PMJ, and ABDM from Goa. Thank you.
Sorry. ओपन करूँ
Good afternoon, everyone. Myself Dikshita Borkar, Operations Manager for ABPMJY from SHA Goa. ABPMJY was launched in the state of Goa along with the national launch on 23rd September 2018. We are running the scheme in trust mode and we have hired implementation support agency named MD India Health Insurance TPA Limited. We have around 36 hospitals empaneled under the scheme, 22 public and 14 private hospitals. Along with ABPMJY, we also have our state-run Deen Dayal Swasthya Seva Yojana running parallelly in the state. Deen Dayal Swasthya Seva Yojana was launched in September 2016. Now, coverage of performance of ABPMJY. We have around 36,431 families eligible as per SSC 2011 in the state of Goa. An additional data collection drive was conducted in the month of May 2018 to August 2018, wherein our field functionaries of our Directorate of Health Services could identify 11,344 families out of 36,431 families. Till date, we have generated golden record for around 9,137 families, which is corresponding to 24,265 individuals. Hospital admissions, we have raised 455 cases till date under the scheme. Claim paid, an amount of rupees 70,96,000 has been paid up to 31st March 2022. Current health benefit package version. At the time of scheme launch, ABPMJY package master was designed taking into consideration grade A rates of our state-run Deen Dayal Swasthya Seva Yojana, which are higher compared to NHS package master. So currently state is implementing HBP 1.0 which is comprising of 1653 procedures. The procedures are mapped with our state-run DDSSY scheme, and common procedures of NHA and state-run are having same package rates. Next. Portability cases. We have around 121 inbound portability cases raised till date and nil outbound cases. Data sharing with NHA. In the state of Goa, we are using all application BIS, TMS, HEM, all developed by NHA. For our state-run DDSSY, we are using IT software developed by our IT partner Goa Electronics Limited and our appointed implementation support agency MD India Health Insurance TP Limited is providing TMS software. So considering this, National Health Authority has suggested us to provide IT platform that is beneficiary identification system, transaction management system and hospital empanelment module free of cost for our state-run DDSSY scheme. The same process is ongoing. Next. Fraud trigger integration with NAFU and status of suspected cases. We have 462 suspected e-cards and fraudulent e-cards deactivated are 10. E-cards under investigation are 11 and suspected e-cards which were found genuine were 441. Next, about integration of building and other construction welfare board. We had various meetings with the labor department wherein issues related to the financial implication to include the BOCW workers were discussed, and also sharing of the database, the data of the construction workers. We are awaiting for concurrence from the BOCW department as of now. NFSA integration for Rashtriya Arogya Nidhi and Health Minister's discretionary grant. This has been already integrated for Goa. The empanelment of agencies for beneficiary felicitation. At present, we are having our implementation support agency they have deployed PMAM Pradhan Mantri Arogya Mitra in our 22 public hospitals, and they are only doing the role of beneficiary identification, screening each and every patient at OPD and IPD level and generating their golden record. So we have not hired any beneficiary facilitation agency because we are paying our implementation support agency fees for appointing PMAM who are doing the role of beneficiary identification. Also, PMAMs are visiting door to door and enrolling beneficiaries under the scheme. We also have engaged UTI TSL in e-card generation. SHS Human Resource Strength Compliance, 2 operations manager. We have 2 medical management quality manager, 1 finance manager, 1 monitoring and evaluation manager, 1 IT support cum data manager and 1 accounts assistants. The status of deployment of district implementation unit. Goa being a small state, all implementation we are taking care at state level and there is no district implementation unit. Launch of Aapke Dwar Ayushman Enrollment Drive 2.0. Currently, our PMAMs are visiting each and every beneficiary in villages and generating their golden records. Also, our Honorable Chief Minister has launched Sarkar Tumcha Dwari, a drive wherein various departments in the state come under one roof and they spread awareness about the scheme. Here we get an opportunity to put a stall for PMJY to spread awareness, and we also do calling before a camp is organized in a particular village. We do awareness and we call beneficiary at that location which is nearer to them so that they come and get their golden record done. Then adoption of HBP 2.2. At present we are using HBP 1.0 and we also did a preliminary comparison between our state procedure and the present HBP 2022 which we have found out that it is our state procedures are 20 to 30% higher than the HBP 2022. Now I'll hand over to my colleague.
Hi. Some key initiatives are beneficiary identification. We do door-to-door visits, meaning our ISA, which is engaged, are doing door-to-door visits. Then beneficiary expansion base, the tagging exercise of NFSA families is under process. Beneficiary awareness and IC activities about the schemes. We do sensitization workshop for healthcare workers, Anganwadi workers, ANM, social workers, public leaders, and departmental officials. Hospital engagement visit to hospitals. So there is a weekly meeting which is being organized with the hospitals in order to resolve their issues which they face. Also improvising utilization in public hospitals. So incentives are also provided for treating doctors, nurses in order to encourage cases from the hospitals. Next, scheme conversions in 23rd August 2019 in the VC, NHA CEO had proposed for conversions of ABPMJY and DDSSY. And the key points for the conversions were unified scheme name, common wallet amount, common implementation and support agencies, a common IT platform, and common hospitals. Subsequently, in September 2020, under the chairmanship of Honorable CM, so it was discussed that the both scheme will go parallelly, and this was conveyed to the NHA team, post which the NHA official proposed that SHA to utilize the NHA IT platform by implementing IT integration. So these are some of the requirement gathering we have shared with NHA. Next. Claim settlement under ABPMJY claims are settled within 24 hours of approval by the SHA doctors subject to submission of mandatory documents. Fraud and abuse controls, we have minimal cases under the schemes, and each cases are audited by our SHA doctor. Now, some of the key challenges which we face are operational challenges. Hospitals face issues with respect to the TMS systems which is there, and there is also bioauthentication devices which sometimes does not work in time, and because of which the patient has to suffer. Now, related to policy-related issues, there is no nil policy-related issues. So the future roadmap for ABPMJY, the state has not yet reached a saturation level in generating the Ayushman card, and the tagging is in process. Hospital engagement, there is a continuous effort that more and more hospitals are engaged in PMJY scheme. So some of the inactive hospitals, we are trying to meet the higher authorities, discuss with them, and we try to understand. We are planning to issue notices also in case if it is required, and de-empanelment of those kind of things which are there. Next. Now, some of the suggestions what we feel is that there should be some prompt technical support which we really face regarding raising of the tickets which sometimes are kept on hold. So that is what we feel. Okay. Next, like Dr. Kedar and Dr. Yogesh.
Sorry.
Thank you so much, Pawan Kumarji. I request Dr. Kedar Raikar to continue the presentation for ABDM. Thank you.
Hello friends, good afternoon. First of all, I would like Maharashtra government for organizing this event over here, beautifully organized. And I'll just run through the slides very fast because most of the things NHA already knows about it. We are in a process of having a vertical aids and a PMU. Other things with regards to the our HMIS operation is eHealth Goa, and as of now we are trying to implement it at a level of district hospitals, both the district hospitals of North and South. Over 3,333 odd numbers we have done Abha cards, and government all facilities, that is 289 facilities are already registered, and private we are in the process of doing in next 3 quarters. And with regards to professional registry, we have just started, so we'll be working with the verifiers and we'll enroll them. Next. As mentioned, out of 15 lakh population, Goa being a small state, Abha generation is around 3,33,000, and remaining will be in all the 3 quarters, we'll try to complete it. Next. Facility registrations, we managed getting it done thanks to Kritika who had come down to Goa. We managed getting it done in 2 days' time. So all health facilities under public sectors are covered. Private, I know it would be a challenge. So we'll need a lot of IC and capacity building, which are planning in the next few quarters. Next. This is what we have planned, how to go ahead with the HPR in a few quarters with regards to both doctors and nurses also. Operational approach, governance structures, posts have been, next. Posts have been advertised in verticals in next couple of months. We'll have the verticals. After that, in a couple of more months, we will be having a PMU. And we have proposed for funding under NHA for various capacity building IECs and HR also. Next. This is the way we are going to do. In next 3 months, we'll try to integrate at district level HMIS, and in next 12 to 18 months, we will have it all across our CHCs, PHCs. Next. Capacity building, we have asked funding under NHA, and accordingly we will do the capacity building. Next. Similar thing is with IEC. Next. We'll try to integrate the public health schemes with the Abdm. Next. Challenges, funds, most of us would have it. To start our office, we need at least, right now we are functioning under DHS, but we would need proper office space, procurement of hardware to run this office space. Administrative expenses definitely is an issue for most of us, and we would like under which head under NHM in the PIP we could propose, so that in the supplementary or in the coming PIP we could ask funding under NHM. So these are the few challenges we are looking at. Thank you.
Yes, sir. Sir, ये किसका है? This is going. नहीं
ये आपका नहीं है,
ये
नहीं है आपका।
हाँ ये डालो।
अच्छा, आप इधर से बोलेंगे ना।
हाँ हाँ। Good afternoon. Behalf of Government of Gujarat and behalf of Honorable Commissioner Madam, ACS Sir and MD Madam, we are presenting Pradhan Mantri Jan Arogya Yojana and Mukhyamantri Amritam Yojana. Gujarat is a pioneer of insurance, and they have started as a state flagship schemes like Mukhyamantri Amritam scheme in 2012, then followed by in 2014 as per the requirement of the community of Gujarat, and it is started as a Mukhyamantri Vatsalya scheme. And Mukhyamantri Vatsalya scheme is depend on the 12 parameters like the income, 4 lakhs annual income individuals or senior citizens less than 6 lakhs incomes, and other categories. Then in 2018 PMJY has been started. Total beneficiaries in Mukhyamantri Amritam, it is 5.81 lakhs, and Mukhyamantri Amritam Vatsal, it is 56.4 lakhs, and PMJY it's 76.3 lakhs beneficiaries, and total beneficiaries are 50.31 lakhs beneficiaries, and total card issues is are 1 crore 38 lakhs. As per the enrollment card issued, Gujarat is 4th in country, and in pre-auth generation it's 3rd, and pre-auth amount it's at 2nd, and claim submitted amount it's in 2nd in the country. So now all Ma Vatsal beneficiaries are getting benefits under Ayushman Bharat PMJY Ma schemes. It is renowned as a PMJY Ma scheme for the Gujarat. Cashless coverage is for the all 3 schemes is 5 lakhs per family per year. Insurance premium at present 2 insurance companies are working, Bajaj Insurance and Oriental Insurance. So premium is 2,177 rupees per family per annum, and it will be, as sir already told, now this is last month, and it will be just shifted as a hybrid mode. So there are 2,711 procedures, and it's a cashless benefit. Funding pattern is as per the SEC data, means it's for only out of 79 lakhs families, only for 43.44 lakhs families, it's GI is funding 60%, and state flagship schemes like Ma and Ma Vatsal scheme, the 100% state is submitted. Next. So the claim status is in till now, till date it's 30 lakhs 25,151. So total pre-auth amount has been generated 5,467 crore rupees, and claim submitted 29 lakhs 29,255. So it's a claim status. Amount paid per inside portal, it is actual paid is 3,900 crore rupees. So state has already implemented health benefit package 2.0 and 2.0, and HPB 2022 under process. State specific procedures is also theirs, and one request from NHA is that there is a tier system is A, B, C needs to be clarified, because some of the hospitals are in the rural setups, like Apollo Hospital near about Ahmedabad, but it is not count as a Ahmedabad. So they couldn't benefit of the A category hospital services. So it is my humble request, and portability cases like incoming portability cases is 5,10,016, and outgoing portability cases is 2,479. So it is showing that Gujarat is a hub for the medical services. So we have a good quality of the hospitals. Next. The fraud trigger generation, trigger integration. So one request I want to with the NHA, whenever the triggers has been initiated, then has to just ask to the or discuss with SHA. So we can just some suggest about the actual thing which is going on. Next. The status of the deployment of district implementation unit. Every district have district implementation unit in process, and nodal persons of district is district quality medical officer. He is a he is a very senior officer, and under his command, whole of the district is running this program, and every district have the district program district project coordinator from the our government side and from insurance side also, and overall supervision and monitoring has done by the respected chief district health officer under command of the district collectors and district development officers. So launch of the Aapke Dwar Ayushman enrollment 2.0 is running. So state has already launched, and it's a rollout for the from July from 2022. Next. Status of the various activities like integration of the building and other construction workers. This is already covered in our Mukhyamantri Amritam Vatsalya scheme. This is one of the scheme, one of the beneficiaries out of the 12 beneficiaries in Mukhyamantri Vatsalya scheme. NFSA integration for the Rashtriya Arogya Nidhi and Health Minister discretionary grant has already completed, and NFSA API integration integrated with the specific fields for the REN and HMDG. Impanel for the agencies for the beneficiaries facilitation agencies is recently state decided to implement PMJY MA from the 100% insurance to the hybrid mode, which decision has already taken, and it will be converted in few months. Data sharing with the NHA, the SHA has integrated with 3 API, and one is a specific enrollment data. State has already decided all Mukhyamantri Amritam and Mukhyamantri Amritam Vatsalya scheme has to be integrated, and they have to issue all the PMJY MA cards, and upcoming API is this income certificate, which is the already Jumbis has been started at all the places and all the districts, which will come soon, and it will be also generate the API, and it will be converted in our PMJY MA schemes. Then upcoming is NFSA data. This file has already run and reached to the finance department, and in 10 to 15 days decision will be taken, and it will be sent to with the permission for the NHA. So we have to give the cards to each and every person. Next. Gujarat government is already nominated for the Joint Review Mission. Dr. Pathak ji, he is a retired additional director for medical services as a nodal officer. Then incentivization of staff in the public hospitals like 40% for the treating doctors and 40% for the paramedical staffs and 20% for the class 4 staff. The guideline has already issued. Concurrence on the green channels payment system, it is under process. It will be, and then we can get result very soon. Next. Key initiative like the beneficiary identification. Recently we have get the data of PMJY to PMJY Ma to Ma Vatsalya schemes data to convert in PMJY. So the bulk printing of the Ayushman Bharat is already going on for the weekend. We have got a very good help from the NHA. And beneficiary expansion ways, the many state-specific categories have been integrated under the scheme with through the Mukhyamantri Vatsalya schemes. And PMJY has merged with the Chiranjeevi Yojana and Bal Sakhya Yojana, which was also a state-specific schemes. Green corridor facilities in all government hospitals are there. 3 hours stat for the pre-auth, after which the auto approval is there for the, especially in Gujarat. For the package like the transplant and joint replacement, and cost is shared between NH and SHA. Next. IC activities, a dedicated IC cell is there. Achievements, these are the achievements of the SHAs. From 2014 to 2019 by the different functionaries. And next. So IC activities are a dedicated IC cell is there, which contains the medical officers, dentist and IC consultant. And during the 2022 and 2023, the IC plan has already developed the cost of 14.09 crores rupees. Then which is already shared with the NHA. Improving utilization with public hospitals, continuous awareness through various kinds of the IC activities and at the field level by the BC, by my honorary commissioner sir, ACS sir letter already issues to the involve our this is a continuation scheme. And the release of fund utilization guidelines on public hospitals time to time has been done. Working on the OM dated on from 22 June 2022. Fund utilization in public hospital, 20% of total claims are booked in public hospitals. Next. Sir, one Ayushman card to the all PMJY beneficiaries is the scheme coverage. Next. It's integrated with income certificate API with the live ration cards APIs to combat the fraudulent activities. Next. So claim settlement means 6 lakhs, about 6 lakh claim has been submitted. And 1,756 crores rupees claim already submitted, and 65.87% is paid. 7,000 cases which is not visible in portal, so it is request to the team NHA. They have to help, and we will improve our the claim payment status also. Next. Reduce the fraud and abuse control. Some of the cases like hysterectomy and TKR, we are given a circular to needs the CDMO, civil surgeon's letter, so decrease this is the flow control. Next. Sir, we have 74,500 525 cards disabled. We have done due to by SAFO activities, state anti-fraud activities, and 12,146 VIS ID has been disabled. Next. Challenges are the key challenges operational, very frequently issue related to software, VIS, TMS. So these issues has been, some of the issues has been solved in last week, and NHA is working, and with the help of NHA, we will solve these issues and key challenges is HBP 2002 revisions of the package rates is policy related issue. Then future roadmap is Ayushman card saturation. The government of Gujarat is committed at from the higher level to the doorstep. All Ayushman card saturation has to be done, and removing non-working private hospital. They are not working, then they have they will be removed. And a left out beneficiaries identification blockage of the non-eligible beneficiaries card triggers on the beneficiaries duplication. So next. Increasing uptake of scheme. So the awareness generation among the scheme beneficiaries on the campaign mode. Bande Gujarat Vikas Rath Yatra will be started from the 5th July to 19th July. The motto of this Bande Gujarat Vikas Yatra is to saturate these schemes at the grassroots level. 82 ruts will go in different zones of the whole of the state will cover, and all the political commitment and our officers' commitment is there, and this Jumbis will be done under the leadership of district collector, sir. Mahajumbis has already started from the 7th of April, and that is going on, the just renewal of the income certificate and just enrollment of the new beneficiaries. Azadi Ka Amrit Mahotsav in every, just like a Seva Setu, just like a in Gram Sabha, just like every activities is going on in our Gujarat, which is the program of PMJY Ma enrollment, and IEC is a basic program for that. And Niramay Gujarat and toll-free number is also there. So so many activities is going on for the saturation of this scheme in the Gujarat. Reducing TET for the pre-auth and claim settlement is there. Next. Sir, we have 787 private hospitals and 1,881 public hospitals, and out of that, from last 6 months, private out of that 599 private hospitals are working, in total 885 hospitals. So non-working, we have to be take a strong actions under a chairmanship of our commissioner, sir, to take a harsh action these peoples and identify the problem why they are not. Next. So suggestion is timely resolution of IT. So many IT issues has already resolved, and consult the state before any major deployment. So these are the my some issues. Next. So I will request Mr. Ravi Shukla for the ABDA.
Good afternoon, everyone. I will brief about the ABDM program of Government of Gujarat. Next. In Gujarat State Mission Director, MD NHM is the State Mission Director, and we have identified the district verifier, district nodal officer, and facility manager. In Gujarat, we are using hospital management software developed by TCS. The software was developed in the year 2006, and since then it is running so many hospitals, basically in district hospital, medical college hospitals, and GMERS. At present, it is running in 33 hospitals of Gujarat. In terms of ABA, we have created more than 83 lakhs ABA. In terms of health professional registry, we have developed the ecosystem of district verifier and district nodal officer. At present, we have generated around 34 HFR, and in the up to next quarter, we are able to complete the total 100% government facility. In terms of ABA creation, we have run a drive through so many programs. We have through Nirame Gujarat program, which is for NCD programs. So we have created around 5 lakhs ABA through NCD programs. Through Ayushman Bharat card, we are also generating more than 42 lakhs ABA through Ayushman Bharat PMJ card. So our target is by the end of this year, we are able to generate 100% ABA. Next. Because ecosystem for HFR and HPR is ready, so we are able to generate HPR and HFR by the end of next quarter for 100% government facilities as well as 100% government doctors. And up to the end of this year, we are able to generate 50% facility, private facility, as well as 50% private doctors. Next. Actually, at present, we don't have a PMU structure, but we are in process to float a tender for PMU. At present, government officers from IT department has been deputed in the Health and Family Welfare Department, as well as we are having empaneled agency through which we can hire the IT resources. So we are having more than 5 to 6 empaneled agency who are providing the IT resources. So we can get the IT resources from those agencies. And we have proposed around 120 lakhs for HR resources. Joint Director IT has been recruited, and by the end of July, by next month, he is going to join. And for Joint Director Administration and Joint Director Coordination, we are planning to depute from our state cadre. Next. As I already mentioned, in Gujarat, we are using GHMIS software, which was developed by TCS. It was deployed around 35 hospitals, but the software was developed in the 2006, so the architecture was decentralized, so it was server-based architecture. So as per ABDM requirement, we have to go for a software which is cloud-based, which is having central architecture. So we are planning to float a new tender for the HMIS solution, which is open source technology based, which is cloud based, as well as having the ownership right with the state government. And in terms of infrastructure availability at our health facility, we are having hardware as well as connectivity, as well as all the things available in terms of infrastructure. Recently, we have completed the training for district verifier, district nodal officer, facility manager with the support of ABDM team. We are planning to create a master trainer at each districts, and we are also planning to physical training at regional level so that we can sensitize the people at the grassroots levels for the ABDM program. And we are having our State Institute of Health and Family Welfare, where we are planning to conduct a training for trainers. Same way, we are planning to club the IEC activity of ABDM at present with PMJ IEC team. We have also conducted so many IEC activity during various health mela conducted by state government. Also, in the next month, from 5th July to 19th July, Vande Gujarat program is going to be launched. So we are planning to do so many IEC activity along with that. Next. State government is also planning so many schemes, like recently we have integrated TECO applications with ABDM. So through TECO application we are planning to generate ABA, because in TECO application our ASA workers are going for home survey every year. So most of the families are completed through this survey. So we are planning to generate ABA through this scheme. Same way, we are planning to generate ABA number through PMJ card, and also we are create a repository of HMIS solution, particularly PMJ empaneled hospitals. We are going to approach them and we are trying to convince them to integrate their HMIS solution with the ABDM. One another thing that recently we have Jermis portal. During COVID we have Jermis portal, through which we have enrolled around 2,300 facility in the Jermis portal. So we are planning to integrate that application with ABDM, so we can able to generate more than 2,300 facility in the ABDM. Thank you.
आज बैठूंगा ना सर, ये दिखा देंगे कैसे यूज़ करना है, कैसे यूज़ करना है डैशबोर्ड।
डाउनलोड का मेरे वाले में करवा देंगे, बात करते हैं।
Thank you very much, Dr. S.G. Jain and Dr. Ravi Shukla ji. It was a very nice presentation. Gujarat being one of the most advanced and most wowed state for having a very quality-oriented health services across the state. We have very good expectations from Gujarat, and the numbers have shown the results. Well, ladies and gentlemen, this brings to the conclusion of our program for today, and I hope you all enjoyed the program, getting a lot of information, sharing views, and the presentations were very helpful as well. Yes, and just before everyone heads out of the auditorium, last but not least, please do fill up the feedback form, ladies and gentlemen. As of now, I'm concluding this program. We'll see you tomorrow back again at 9:50, tomorrow in the morning. Thank you, everyone. Have a nice evening. Thank you.